The content provided in this video is for educational purposes only and is not medical advice. For medical advice, please schedule an appointment with one of our Hope for Healing providers or the appropriate medical professional. This material is the property of Hope for Healing and is not to be shared or replicated in any way without written consent. Thank you. Welcome, Dr. K. Thank you so much for coming in for part 2 of our How We Can Support Our Neurodiverse Children. And so just thank you so much for talking to us, really like how our practice is a little bit different, what's kind of going on in the last one. So if you haven't watched part 1 of the video, I definitely suggest to give it a try. But this time, we're going to be talking a little bit more about the specifics of the different ways that we can support them, whether that be language and learning, behavioral and emotional support, and how precision genetics kind of ties into all of that. So let's get started. Okay, so when it comes to language and learning, I think there's so many amazing submitted questions. But this one is what I'm going to kick it off with is what are effective strategies for improving language comprehension and writing skills in children with autism who have low vocabulary skills?
Okay, that is a loaded question. So, the first thing I'm going to do is back up a little bit because
Of
when a
course.
parent is seeing a child that doesn't have a lot of vocabulary and they're trying to help them learn to write and to comprehend, then you have to determine if their brain and their body is receiving the nutrients that allow them to do that. So, couple of big principles that are very important. There's a process called autophagy where you take glucose from your bloodstream, from the food you eat, and pull it into your cells. In order to speak, in order to learn more vocabulary, you must be providing the brain and the nervous system, the brain, with the raw materials, which is glucose to begin with, and then also the mitochondria. Mitochondria produce energy or ATP, and we talked about that briefly before. So when we
Mm-hmm.
think about autism, there's two big areas. It's inflammation and mitochondria. Those are common themes in children with autism, but many, many, many have impaired autophagy, especially when language is concerned.
Mm,
So I highly encourage people to do the precision genetics because you're going to spin your wheels and get
right,
frustrated in trying. You're going to start thinking, oh, is it my problem? Am I not a good teacher? What's wrong
right,
with my child? There's nothing wrong with your child. That you need to know what they need and what they don't need.
right.
So, whenever I hear about language and that comprehension, I'm like, are they receiving enough autophagy support? So,
Okay.
the precision genetics would speak to that, and then by providing a child with, it's typically DCI twice a day, and it's naturally
Right,
sweet. But you want to see if that's the only thing. You don't want to just do one thing in isolation.
right.
Then, when we think about comprehension
Mm-hmm.
and language, a lot of times you have to look at what, like a speech pathologist would do.
Mm-hmm.
You need to get down to the level of the child. If they're a lot shorter than you and you're looking above them, it's good to sit on the floor with them and to try to get their attention so they can see
Mm,
how your lips are formed, and maybe even use a mirror, okay, when you're trying to get them to pronounce things. But
so
also,
good.
when I
Yeah.
think about language, you need to think about physical restrictions. Having a severe buckle or tongue ties,
Mm,
having a bad under the tongue center tongue tie, or even having a lip tie with poor fascial movement and a poor airway, you got to look at everything. So if your
mm,
kiddo can't seem to say certain things, you also have to back up. Can they hear? They need a good hearing test. They need a good eye test. And
mm,
I
mhm.
highly encourage people to. to take their children to a developmental pediatrician, optometrist. So there's a woman named Catherine West, OD, off of 1960 in the North Houston area. And then there's a practice called Bel Air Family Eye Care down in the Memorial Bel Air area. And Voss is an OD there, and there are several other optometrists on staff there. So they can examine the vision and make sure that's okay. Then you make sure your child can hear, and then you get them in to see a dentist that has airway training. So, like
Oh, wow.
Westview Dentistry downtown, Dr. Gandhi. There's a couple of other really good pediatric dental practices. We could ask Tony Boyajuan, our doctor of nursing practice at our downtown office. There's someone, it starts with an a
Mm-hmm.
dental practice that's very airway and very up on lip, back tongue, and forward tongue ties. And if your child can't get their tongue to move, you're going to need to work to strengthen that. And then also
Mm-hmm.
Kidstown Dental, which is out in Katy. Now, that's language. All right.
Right.
Now let's talk about writing. In
Mm-hmm.
order to write, you have to see the written word and you have
Mm-hmm.
to be able to copy it. And when you
So
write
good.
something, it locks it in and turns it into muscle memory. So there's a
Mm-hmm.
very good writing curriculum called Handwriting Without Tears. And that hand eye coordination involves a process called methylation. Methylation is where we put B vitamins, the right kind, in its methylfolate in at the right time, right place, but you're
Mm-hmm.
also supporting mitochondria. So before you get hot and bothered, start with eye and ear assessment, then get
Mm-hmm.
that airway and that tongue assessed by a qualified pediatric dentist that has airway training and
Yeah.
tongue and lip ties, that might even be buried below the connective tissue, restricting their
Mm.
tongue. Somebody could look in their mouth and say there's nothing there that's restricting the movement, but it could actually be what's called a submucous tongue tie. Okay.
Wow. Yeah.
And then I'm not trying to beat a dead horse, but those genetics provide us with all of that. And then if you rule out all those other things and you're supplying autophagy, methylation, the last thing to kind of seal the deal is mitochondrial support. It's fuel to the mitochondria to make it work.
So good.
And that would help with that language and learning and accumulation of new vocabulary words, um, and getting right close by and
Mm-hmm.
focus. And when we think of language too, when a child cannot pronounce a hard consonant at
Mm-hmm.
the end of a word versus messing up their and their and their like feather, lello feathers, spaghetti, like little tongue thrust things
Yes.
versus the initial consonants versus and the end like a hard D, or being able to get their tongue up to the top of their palate right behind their front two teeth. So there's so
Mm-hmm.
much to that as a parent, it's like, oh, I hadn't thought of all these things.
Right. Right. Absolutely.
So I just wanted to provide that framework that you start with the senses and the mechanical function, and then look at those precision genetics and move
Mm-hmm.
from there.
Well, I think there's just such wisdom in what you're saying because, and this is kind of what we talked about in the last one, where someone was asking about particular therapies and going to like ABA therapy and like brain therapy and all the things. But what you consistently put is there's an intelligence sequence. It is not the fact that you may not have to end up working with somebody to help them in those things, but to make sure that we're layering it in where these other tools would take effect in the best way, right? So that you may have to
Right.
end up somewhere, but to put them in an intelligent sequence is what we call it, and to understand. And to me, it's the answer to so much frustration. That is so much that
Yes.
plays factors into something as what we consider simple as speech,
Right.
simple as writing, for a lack of understanding. And I just think God is really cool that it incorporates all of those factors. So
Yes. And I think for parents, taking the
mm,
pressure off yourself, especially if you are trying to homeschool your neurodiverse
right.
child, um,
Mhm.
that you think that there's a problem with you
Right.
and you need to extend yourself grace and then also to layer these things in, because if you do, your child will accumulate these milestones that you think
Mhm.
they should know. Sometimes they can do it in record speed. And I can say that on the backside after
Right.
recognizing in two of my daughters some visual tracking disturbances. And
Mhm.
then I was beating myself up. I took one of them to an optometrist, an ophthalmologist, and it was the third trip to the optometrist. Well, the optometrist was the third medical professional, but I did that
Mhm.
initially. And that's when they discovered that my child was moving their eyes back and forth across the page 80 times a minute.
Wow.
No wonder they could not read. Their
Mhm.
eyes and their brain were so confused. And that might be going on with your little one. And you
Right.
may be expecting too much and expecting too much from yourself and from them.
Mhm.
So take the time, get those answers. Don't spend money on a bunch of therapies unless it's literally warranted.
Mhm. Well, because there's steps, right? We're not saying it will never be the step. We are just saying make sure you have all the tools in your tool belt so you know which steps to move forward with. So I really appreciate that. Okay, so this is another really great one is how can reading difficulties such as seeing letters move be addressed? So I feel like you kind of talked about this, but can you tie it together with what you've been sharing with us already?
Yeah, so that's where if you find a good developmental optometrist, and I named them earlier, and we can
Hmm.
put them on to the link there
Absolutely.
when this is published. But there's a condition called Irlen's syndrome,
Hmm.
IRLEN apostrophe S, where children and adults will describe it's like the letters seem to flow off the end of the page. And it's all intimately involved with our beautiful brain and our optic system, and sometimes using special
Hmm.
colored overlays on what you're trying to read,
Hmm.
but also having glasses that may have those special colors built in will
Hmm.
help. And that Erlands will tend to go away if you're lowering the inflammation in the body, providing the body with good autophagy, energy support, giving the body
Hmm.
methylation, which fuels those nerves in the brain and the eyes, and then giving the mitochondria support. A lot of these weird things that occur with the visual system and neurologically go away.
Wow.
But Erlin's is one of those things that presents with the letters flowing off the page or requiring those overlays. But one simple hack that you as a parent can do is, you know how when you go buy sheep protectors that are yellow and green and blue that are transparent with a pocket, just cut the pocket off and try those overlays and see
Hmm.
what works for your child. Like if you can't afford to get them into a developmental optometrist right
Right.
now. But on the other hand, I'm thinking you can't afford not to get the answer, because
Right.
otherwise trying to teach them to read is banging your head against the wall.
Right, exactly. Well, and it's kind of what, while you're saving for it, while you're doing what you need to do to get it, or even finding a way to get in, sometimes these specialists do have a
Yes.
harder time. What we can also do is we'll link. I know for a fact that Amazon has a really cheap set of them that we can link to them because I have to use them whenever my inflammation is up. So
Yes.
that's how I
And
know.
and they should be really thin with
Hmm.
different colors, like the
Yes.
cheapo sets. And right now, if you want to go, well, Amazon, yes, but also Walmart and all the other places, the back to school stuff, you might be able to just walk in and it's worth a shot. I mean, you're going to pay what, $2 to get
Yeah.
these cheap little index dividers. There's nothing wrong with just trying them.
Absolutely. So I think that's really great and useful tool. Okay, this is one that you really I we talk through these questions, and this was one that I really loved because I also really loved your response because I it was so simple and wonderful, which is what strategies can help children will help us recognize when a child is completely distracted and completely off task, because it's so true. I have so like I've worked with children in the past and it looks like they're there, but you're like, are you? Like, are you
Mhm,
focusing? I don't know where
mhm.
you are. So, how can we
Yeah,
tell when a child is extremely focused versus somewhere else?
yeah. Well, it's I don't know if parents, it's like, you try to get their attention and you're like, you get to their level, you ask them to look in your eyes. They may not want to, or just say,
Mhm.
"Hey, do you hear me, Susie? Susie, would you just look me in the eye for a minute? I want you to go upstairs and pick up your socks, bring them downstairs, and we're going to put them in the laundry." If they may look at you like a deer in the headlights, and I would have them just repeat back that simple
Mm, mhm.
thing and then say, "Would you just tell me what I just told you? I'm just trying to figure out what you're getting." And then if 20 minutes goes by and Susie never comes back, then there's a disconnect here. um,
Right,
then you get them and you say, "Honey, do you remember what I asked you to do?" And if they look at you like a deer in the headlights and they go, "I forgot," or "I really don't remember," it's kind of your clue that maybe your child has some significant brain inflammation. And if
mm,
that
mhm.
happens every day and you find yourself having to repeat stuff,
Mhm.
that's where I love what's on our wellness blueprint, what's on our neurotransmitter, but it's included in wellness blueprint is neurotransmitters and methylation. And it's like kiddos feel bad because and then parents get mad. They're like, "My
Right,
kid is deliberately trying to not do what I say."
right.
That may be the case, but if a lot of times they're just deer in the headlights and you're like, "Hey, so one thing, I would create systems if your child does that a lot and they're going
Mhm.
to school and they're high functioning, or they're not even autistic, but they just have these learning challenges.
Mhm.
ADD, ADHD, it's all a spectrum, y'all. Is
Absolutely.
I love having a laminated checklist. So you take all the guessing out. You
Yes.
have your morning checklist, you have your evening checklist. You have consistency. You lay out the clothes the night before, you make the lunch the night before, you pack the snacks, engage your child in the activities, and
Right.
create in your pantry something simplistic. You need to have at the kids level, go get your snack and you've got chomps in one bag or one bin, you've got kind bars in another thing, you've got
Yeah.
your fruit bin. Remove those obstacles so that if your child can read, if they can't, then you can make pictures so they've got a little something that they can check it off, but also have a very easily obtainable reward system. Like
Mhm.
you get 3 days in a row, you get the grab bag, or you can pick, go to the dollar store, make sure it's non-toxic, try not adulterated stuff, but stickers or pencils or markers. And this is where you go buy those cheap school supplies and throw them in a big bag and
Yeah.
say, look at this basket, look at all this good stuff. Does that answer the question, Lauren, about getting attention?
Absolutely.
Okay.
Yes. Well, because you and you kind of mentioned it before also is like we're lowering ourselves to like we're seeing eye to eye with them and like we're putting ourselves in the almost in their shoes as well as trying to get them to mirror back because you're almost mirroring them and they get the opportunity to mirror you. Okay, so another question that was submitted is what strategies can help us recognize when a child is either distracted and how can we help them complete tasks effectively?
Great question. We're going to go back to basics again. Number one, do they hear you? Do they see you? And it's really important when a child is trying to complete tasks, I think it's to verify that they actually heard you, comprehended
Mm,
what you
mhm.
said. So it's a really good idea if they're little itty bitties to kind of get down to their level or sit them up by you and look at them and say,
Eye
hey,
to eye. Mhm,
Susie, look in my eyes. And then ask them, give them the instruction and then say, what I want you to do is listen to me, then tell me back what you
mhm,
said, because learning to listen is a skill,
mhm.
and it just depends on the developmentally appropriate level where your child is at, if and so then another strategy is actually, especially if you as a parent are finding yourself frustrated, go with your child and show them what to do and have them
Love
do
that.
it. Like help them clean up their toys or help them do this. And you can sing a dumb little song while you do it, like clean up, everybody, everywhere, you know. But another thing that will be a clue to you as a parent is if your child's a little bit older and you say Susie or Johnny, I want you to go upstairs, get your dirty clothes, then bring them down here into the washing area so we can sort those and do our wash.
Mhm.
Then 20 minutes, and they repeat back to you what you said, and they're off on their
Right.
way. 20 minutes goes by, and you don't have a kiddo, nor do you have dirty clothes. So you're like,
Right.
Johnny, Susie, where are you?
Mhm.
So, and if you get their attention and it's like, do you remember what mom told you to do earlier, and you even told me back what to do?
Right.
And if you need to give them a clue, like, does this ring a bell? Like a dirty sock or dirty underwear? Just, do you remember what mom said? And they look at you like you're a deer in the head, like a deer in the headlights, and they truly don't remember, and you don't think
Mhm.
they're lying. I forgot. Then to me, that's a clue that there's some significant brain inflammation going on, or
Right.
something's not
Mhm.
jiving with their neurotransmitters. So
Mhm.
at that point, because we know that dopamine helps us with short term memory, focus, concentration,
Mm.
organizational skills, sleep stability, mood stability, and hormone regulation. They're forgetting little details, short term memory. Then I would say if you haven't done it already, those precision genetics, that investment gives you an outline and a reason why. And a lot of times as a parent, you see it and you go, it's not me and it's not my kid. It's the biochemistry involved. So, how can
Right.
I optimize their biochemistry? So, those are just a few strategies.
No, I love that. Well, and first, before we even go into strategies, I really appreciated that you were like, this is how we look for if we need to implement these strategies in doing what is next. Okay, so you mentioned neurotransmitters a few times. Can you talk about what a neurotransmitter is and their support of the brain function?
Right. So we have in our brain excitatory neurotransmitters like epinephrine and norepinephrine, or adrenaline is epinephrine, and glutamate,
Mhm.
acetylcholine. And then we have calming and happy neurotransmitters like serotonin gives us contentment. Oxytocin is released by the
Right.
pituitary, and it's like the love hormone. GABA, gamma aminobutyric acid, it's just a everything is okay neurotransmitter. There's other ones, but dopamine is a balancing neurotransmitters. It helps the excitatory and the non-excitatory stay balanced. And if your
Mm,
dopamine is messed up, then everything's messed up. And
mhm,
so when we think about focus and concentration and remembering things, and then a kiddo who has meltdowns, um, those are neurotransmitters. So
mhm.
we look for certain things on our genetics.
Yeah.
Like there's something called GAD1, glutamic acid decarboxylase. If it's abnormal, using something very simple that actually was developed in the 1970s to lower inflammation in the brain when people got influenza A, it
Oh, wow.
modulates a receptor that helps with focus and concentration, and your commercial insurance typically pays for it. You start small and you ramp your way up. Um, you'll find from the neurotransmitters, so many people, when you have a neurodiverse patient that has tics and
Mm,
stimming, repetitious behaviors are there. They're have tics, OCD. They're flicking things off and on. They're
mhm,
spinning,
mhm,
fidget spinners. They want to medicate them with selective serotonin reuptake inhibitors like Zoloft or sertraline and Prozac for tics.
mhm,
Our genetic testing shows us if SSRIs are even a good choice, and you can even do special pharmacogenetic testing. It'll tell you if that GAD1 receptor, there's two that are especially um, prevalent, that have big clinical implications, and if amantadine would help. It will tell us if you burn through adrenaline very rapidly. It
mhm,
will tell us if you're set up for depression and what can modulate that. And it will also tell us if you're set up for profound aggression. The neurotransmitters, there's some other markers that'll tell us if you need high amounts of vitamin C in order to decrease inflammation, and if Strattera, a non-controlled substance, might work for you or your child.
mhm,
So those neurotransmitters are huge, and their communication chemicals throughout our body. We make 95% of our serotonin in our gut, but for the serotonin that's
mm,
made in our brain, that's what you want to modulate with
mhm.
um, supplements or medications that are targeted for you or your child.
I love that. I feel like, so you mentioned this dopamine, right? And I feel like dopamine is a hot topic nowadays because I think it gets talked about in several different ways. So you said that it kind of helps bring the balance, but is there such thing as too much dopamine or too little dopamine then if it's supposed to bring a balance?
Yes.
And what does that
Um,
look like and what does that come from?
there's a process called methylation, and there's 7 enzymes in that process. And methylfolate helps make dopamine, and it
Mm,
helps the body provide the process of methylation. If a person doesn't make enough, they have trouble with short term memory. They have
wow.
trouble with organizational skills. They have trouble with going to sleep and staying asleep. They have
Mhm.
hormone abnormalities. They have a lack of drive and motivation.
Oh,
It's
wow.
not just your testosterone if you're a man and your progesterone if you're a woman, because dopamine helps balance our hormones too.
Wow.
So if you have trouble remembering things, if you're very disorganized, you probably don't have enough. Now,
Mm,
the body tries to make more dopamine by a reward system. So, people who play a lot of video games and get addicted to video games, they're gamers, they're trying to make more dopamine. A child or an adult that has autism is stimming, they're trying to make more dopamine.
mm.
And so when you provide the body with enough dopamine, you tend to calm down. Now, there are different types of ways to provide your body with methylfolate. If you use energy drinks that have taurine,
Mm-hmm.
taurine especially. It's really ingenious, but there's usually a lot of crap in those. Celsius is a little cleaner. Red Bull, not so good.
Mm-hmm.
That gives the body what are called methyl donors.
Mm.
And you can get too much methylation by methyl donors, but there's only a certain amount of methylation, 5-methyl tetrahydrofolate, that the body makes when you use a methylation support like a cream or methylfolate plus or methylation complete, methylfolate pro from our office after you do your precision genetics. And
Mm-hmm.
you can, it's not really over methylation, but you can become very anxious and agitated, crawling out of your skin if you're making too much methylfolate, leading to too much dopamine, and be hyper focused
Wow.
because you drank too much Red Bull and you're shaking and your heart is palpitating at the same time, too. So,
Right.
you want to give the right kind, the right amount, in the right form,
Mm-hmm.
and don't put carcinogens in your body while you drink a popular commercial drink that may have
Right.
methyl donors that helps you make more methylation support to make more
Yes,
dopamine. Okay, does that make
absolutely.
sense?
No, it really does. And so okay, I'm going to do rapid fire clarification real quick. Okay. So just because somebody is low in dopamine and all they want is screen time would not be the healthy solution for getting the dopamine, right?
Right.
Okay. And why would that be though?
Because you're not dealing with the root cause. Why don't you have enough dopamine to begin with? And your life can change.
I love
And
that.
you don't have to be like, the little girl out on the soccer field watching the butterflies doing cartwheels and the little boy picking clover and running after the squirrels. You can
Right.
make enough dopamine in a healthy way.
I love that. Well, and I think it's kind of to what you're saying is that when you have a lack of dopamine, there will not be enough screen time, enough doing all the things to be able to keep you functioning as a regular adult, as a child that has to do studies. And so that is why you need to support the root cause because you won't have enough time to do all the filler and everything because you'll constantly need it, right?
Lauren,
Mhm.
what you just said as an adult and screen time or whatever, methylation deficiency leads to addiction. Addiction is a
Mm,
body's cry for help. So if you're spending money just like, oh, just this one more time, if you are
yeah.
a gambler, if you're addicted to pornography, if you're addicted to
Hmm.
these games, it's a sign that you lack methylation support.
Wow.
And so you get another reward hit with
Hmm.
your dopamine. So that's a clue that you as a parent might have a lack of it, or you need multiple lists to keep you organized
Right.
because it's your way of compensating because you don't have enough dopamine. So, this system, if I create lists, I don't have to think as hard and I won't get behind. So, if you're
Right.
a mama that's struggling or a dad, or you're going from job to job to job, or you're struggling with addiction, or it's been an issue, you can
Mhm.
go through regeneration at your church. You can get all the spiritual answers. But if you don't give yourself biochemically what you need, there's
Right.
always that ability to fall back into that because of that addiction creates more dopamine for you.
Yes.
So that lifeline is those genetics and supplements.
Right. Yeah. So pairing everything together, I think, is what they're, and that's really what we talk a lot about in group coaching is the triangle. Like we have to address your spiritual health, we have to address your physical health and your mental health. And like all of these things play such a key factor. So thank you for diving into that because I think neurotransmitters are, something that is a hot topic without a total understanding of we can't just give them to us when we don't know what we're depleted
Right. Hey, another thing on that,
in.
urinary neurotransmitters are not reliable because they'll fluctuate by so much in a 24-hour period. And there's a lot of companies out there that measure urinary transmitters. And I was going to say, too, at the
Hmm.
top of the addiction list is food. Having
Yeah.
weighed 300 pounds, once I found out that I had such a profound methylation deficiency, I just was, once I provided myself with methylation cream
Hmm.
topically twice a day and oral methylfolate, pro methylfolate plus, the weight started to fall off, and the
Wow.
desire to get my dopamine hits by eating the high
Mm.
inflammatory foods, which give you a hit, but then you crash and burn, like
Right.
chocolate, that's serotonergic, sugar, gluten, dairy. The
Hmm.
desire for those things goes away when your dopamine settles.
Hmm.
And that's the beautiful thing. It really is true.
I love that. Thank you so much for diving into that. Kind of on the same vein, in the sense of the social emotional learning, right? Because that's kind of what that is your social emotional learning of yourself first, kind of understanding what I'm trying to feed when I'm anxious. Things are being depleted in my body, and therefore I need to support the system in a healthy way. For children, now let's go externally, right? So, do you have any suggestions for social emotional learning, like how we can help, whether that's a curriculum or a website, specifically for children that are high functioning autism, have high functioning autism?
Yes, in fact, there's an organization called Autiseeds, AUTISEEDS, and it's for children and it's virtual. It's based in the Houston area, but it can be anywhere in the world. And
Mhm.
it's a way to interact with other high functioning children, young adults with autism to kind of learn social clues.
Mhm.
And this goes along with what we've been talking about. But when you are providing the body with system support, lowering inflammation, giving each cell energy through autophagy support, cleaning out the body with detoxification support, pouring enough methylation support in, giving the mitochondria what it needs, and giving essential vitamins and minerals. It's kind of like a symphony or an orchestra. The body is going to be making what it's supposed to,
Mhm.
and some of more is caught than taught when
Yes.
that's the phrase, more
Yes.
is caught than taught. So as parents with younger children, mirroring the words and not saying no so much, but saying, give them an explanation and okay, because it's not like yes ma'am, no ma'am, yes or no sir. You can teach your child respect, but you get a lot more buy-in when you have a child that's brilliant, maybe neurotypical. But if they're not neurotypical, if you're like you and your husband or your other older children or grandparents all
Yeah.
role play in a time of non conflict. Like you pretend you're at a restaurant. Oh, we're going to go out to eat. Let's put our napkin on our lap. And when the waiter or the waitress comes and says, what are we drinking tonight? You can say, may I please have some ice water with lemon? Or how to tell them thank you. And when someone does something kind to you, thank you for that and name what it is. It's literally breaking everything down. And if you do that at home, because really, we need to be people that at home we are thankful for the
Mhm.
other members of our family. And a lot of
Right.
times we're stressed and we will treat our spouse or our kids when we come home from work after a hard day. We have no
Mhm.
patience for them, no words for them. That's where we need to back up and go, wait a minute. These relationships matter more than anything else, and more is
Mhm.
caught than taught. And the
Right.
way I treat my husband or my husband treats me by words and actions,
Right.
and the way that we treat our little children and our adult children and our bigger, our grandchildren, we really do need to mirror the sanctity of that relationship. And
Mhm.
it's
So
like
good.
part of our culture here at Hope for Healing, our internal culture needs to be a reflection of what our external culture is. I can't, as the chief medical officer and president of Hope for Healing, be kind to our patients but be rude to our team members.
Right.
What kind of a role model am I? And how am I tending and being a good steward to the internal culture of our
Mhm.
team? So, when you think about your
Good.
children and their social interactions, it all starts at home, very
Mhm.
simply, and you pick one or two things that you're going to work on with them. It goes to also how they clean up the bathroom, like when they brush their teeth, say,
Mhm.
here, let's put a little toothpaste here. Now let's close the lid and set it right here.
Yeah.
Now we're going to brush our teeth. Now we're going to spit it out. Now we're going to turn the water on, clean out
Mhm.
our toothbrush, tap, 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 make the water go away, set it down, clean out the sink, dry our hands off. Now we're
Right.
done. Doesn't that feel good? You get a sticker for that. Then
Yeah.
let's move on. You've got an automatic reward. Keep it short, sweet, simple. That gratitude for the chore that you're teaching them,
Mhm.
that everything for age appropriate, don't do for them what they can do for themselves.
Right.
And that is going to give them tools for social interactions that you role model at home every day. And I'm reminded of a verse from Proverbs,
Mhm.
um, train up a child in the way they should go, and when they are old, they will not depart from that. So it's like, it gives you, if you look in the Hebrew, it's like training a puppy, and you're like, not this way but that, not this way but that,
Mhm.
not this way but that. And then eventually they learn, this is the way we go, this is the
Mhm.
way we go. And you're unraveling foolishness, and then you're rolling it up, and you're training them in the way they should go in a loving, kind manner. And it
Mhm. So
begins
good.
at home, and it begins in your everyday relationships, and then you move out to the external.
Mhm. I think I really love that, and I feel the only thing I would, like, add to that is that it really one of the things that I think our parents who are working through this, will neglect is it really begins with the relationship with yourself. And so, like BJ Fogg, which is a behavioral, he's wonderful. If you haven't heard of Tiny Habits, 10 out of 10. But BJ Fogg actually talks about like you like high fiving yourself or you like patting yourself on the back, like I did good. And you're saying to do that with your child, but like BJ Fogg talks about you doing it with yourself. And again, that's what the phrase was is caught, not taught. Is that behavior is caught, not taught. So when they see you doing that behavior for yourself, they will do that behavior for themselves.
Mhm.
And in what I've seen and really loved to hear back from our patients is that when they'll do it or even do it for themselves or for their child, when they are having a bad day, that child will reciprocate it. It's okay, mommy. You've got this. Remember, we're supposed to blank. And like, it's just this beautiful, like, it's been given and received. So that's just, it's super brilliant to be able to see it. Love what you're talking about.
I'm so
Mhm.
glad you said that, because as parents of children who are neurodiverse, you
Mhm.
beat yourself up, you second guess everything and anything you do.
Mhm.
And that internal dialogue, you got to break it. So when your 4-year old says, are you okay, mommy? Are you having a hard day? You're doing great, mommy. I love you so much. And
Mhm.
it's like, they're repeating back to you what you have said to them.
Mhm.
I loved that you brought that up, Lauren. I remember when one of my children was 3 years old, and I was bringing in frozen goods and lawn and groceries from the car, and I was sweating, and she goes, you're doing great, mommy. And she was 3, and I'm like, thank you, honey. And I'm thinking, more is caught than taught. She's repeating back what she had heard.
Mhm.
And that meant a lot.
I love that. I love
So
that.
thank you.
So, of course. So, one of the things I want to touch on before we move on to a little bit more about behavioral and emotional, and because we've kind of talked about that a lot. And so, when we're going to segue into it, it'll be a little bit easier to break down. But for the children that are nonverbal, currently nonverbal, can you talk about? Because I know we have had great like testimonial experience how they feel like they're not listening, they feel like they haven't heard, but then now all of a sudden they can speak. It feels like they're getting a plethora of information to be like, "Oh my gosh, you've been listening this whole time." Can you talk a little bit about that?
Yeah. Um, in fact, I'm going to use this example, and we can publish her name because it's part of her study and or part of
Mhm.
her story. And she said this: a family who, when they moved into a house, they weren't the first owners. Their little girl, 2 years of age, suddenly stopped talking.
Mm,
She did not talk for a long time, but when she looked at you and when she did things, it's like I had the benefit of being a pediatrician and observing thousands of children for years and seeing that looking at her eyes, even though she wouldn't look at me too much, she was hearing everything I said. So, one of the
mhm.
things that we try to do is to not say anything negative about a child when you bring them in for an appointment.
Right,
So, when a parent comes in with a child with the diagnosis of autism, we typically ask for a second adult to come and maybe a distraction device because when we start asking questions, we don't want to say anything negative about the child in their presence.
right.
Can kind of talk around it. But this little girl had been to the pediatric neurologist, and it was
Mhm.
like all of a sudden, one year, she just started blowing up with language. And you know what it was? For years, I'd been asking them to test their home for mold. They finally
Mhm.
did. And the levels inside the home were horrible. They got
Mhm.
out, and whoops, the light in my office there we go, went off. She had been to the pediatric neurologist the year before, and they were in the neurologist's office a year later when she started talking. And
Mm,
she said, "Don't you remember last year I was standing right here and a little red bird kept flying into the window?" Well, for those of you who live in the Houston area, you know that that's cardinals in the fall. They fly into glass, bam. She remembered the year before when she was not speaking, and this mom, it's like a dog with a bone. She
mhm.
demanded that the school district retest her. She had had her child's diagnosis of autism made at a premier children's hospital here in
Yep.
Houston. And
Mhm.
then she's doubting herself. Oh, maybe they misdiagnosed her. I said, no, no, no. You lean into that diagnosis because that diagnosis would be what followed her the rest of her life if you
Right.
had not pursued a global and holistic
Absolutely.
way of restoring balance. So this little
Mhm.
girl, she heard everything that was being said. And when she
Absolutely.
spoke, oh my gosh, she recalled facts. She remembered so much. And
Mhm.
so let the words of your mouth be encouraging words, not like,
Yes.
my child will never learn this. And if you're doing this self beratement in your own head,
Mhm.
stop it. You know how we have
Right.
those negative tapes? And it's like
Mhm.
we revert back there. So to
Mhm.
stop that. But you can't
I
just
love
say,
that.
stop it, because
Yeah.
kids will stop it. You have to figure out
No.
the why behind. But I love celebrating the
Mhm.
little, how are you going to celebrate it? So you'll
Yeah.
just go, woo, I'm high
Yay!
fiving myself. Yay, let's
I
blow
love that.
bubbles. All right. Yes. So thank
I
you,
love that.
Yvonne, for pulling it all together.
No, I think well, and that's really the beauty of it all is I think sometimes when again we can talk about you talk about this a lot when we talk one-on-one is that the spectrum of autism is just that it is a wide spectrum. And so for some of y'all who have high functioning that their children are verbal, and this is a really easy thing to think about, but when I heard her story and many stories of patients of ours when they get their speech back, it doesn't feel like okay, now I have to get her caught up as much as it feels like oh no, they've been receptive and now we just have to get to what she needs in this time or what he needs in that time. And so I just, again, there's so much hope. And I know depending on where you are in this journey, it can feel really hopeless. But when I hear these parent stories of the progress their kids make, and it feels like you said, like a light switch just turns on and they can be, well, that's what happens when your brain is not on fire. And you have the support you need. So I love that. Okay, so let's go a little bit. I know we've talked a lot about like our genetics and about the neurotransmitters. So let's get into some of the little tips that we can kind of talk about, where it is strategies that can help control anger and anxiety in a child with high functioning autism. So a lot of this we do know based on things that you've said is genetics, genetics, genetics. Are there anything like what would be your next step after they've gotten genetics?
Yes, great question. So I don't know if you guys have heard of Dr. Daniel Amen or not, but he is a psychiatrist that thinks very functionally and does these SPECT scans in his office.
Mhm,
Part of my journey, I went to an Amen clinic myself, and when I saw my brain, I'm like, whoa. So, um, panic attacks or freaking out,
mhm,
remember to get quiet, to de escalate, and if you need to remove them from an environment that is very loud, keep it
mhm,
quiet. And that's why sometimes lowering, using a headset to lower what's around them.
mhm,
But getting them into a quiet space. And for panic attacks and anxiety, it's called 418 breathing. You breathe in for 4, hold it for 1, and out for 8, twice as long as breathing in. Do that 5 or 6 times, and that gets you out of your panic attack by
mhm,
stimulating something called the vagus nerve. Another strategy, if they're escalating, but they're not in full on panic and running away and freaking out, is 478 breathing, there's also Wim Hof breathing. Wim Hof breathing is an app that you can get. You can also do cold water, like those little cold plunges. And if you have a shower, it's hard in Texas from the neck down, like 20 seconds in cold water. It kind of calms you, but blowing bubbles or blowing
mhm,
pinwheels, blowing leaves, because if you're prolonged exhale, you can even take, and we do this sometimes in the exam room if we need a child to give us a good forced expiration, is to blow Kleenex, hold it a little further out and go. That's a good way to calm them down too. So you got a
mm,
Kleenex, you've got bubbles, you've got 478 breathing. Now, one thing to consider is if you partner with our team, yes, setting aside genetics and knowing about inflammation and knowing about neurotransmitters, there's also a condition called porphyrin dumping,
yeah,
that comes along when you have infections and profound
mhm,
amounts of biological toxins built up in your body.
right.
And naturally occurring sugar helps with that, but the best thing is to test. It's a simple urine test.
Oh,
I think
wow.
our cash price is like $18.40 with the right ICD-10 code. If you have, or that's the cash price. I don't know what it would be if somebody's met their deductible, but um, that is an issue. Plus zinc and copper balance. You don't know what
Mm,
you don't know. You don't
wow.
indiscriminately start those. But biochemically, there are things that can cause you to be very agitated. And there's also something called autoimmune encephalitis of the basal ganglia, or just autoimmune encephalitis, where you're attacking your brain. There's
Mhm,
circulating antibodies to your brain. So we test for those. But the air that your child breathes, you
mhm,
really ought to test your home with either a Hertz Me Too, or
mhm,
if you own your home, it's called test number 7. It's a Hertz Me, endotoxins and actinomycetes. If you're in it for the long haul, to know that what is going on in your home, especially if your child lives in just this state of panic and fight, flight, fear, and freeze most of the time, and
mhm.
panic.
I love that. Okay. So these are two really great questions. Okay, so the I'm going to go with this one first. Okay, so ODD, meaning oppositional defiant disorder, is that common in children with ADHD? And this has okay. I'm going to let you quickly answer that because the second question is like a kicker attached to it.
Okay. Yes, the answer to that is yes. And remember that the criteria for attention deficit combined or with hyperactivity or just with inattentiveness is a list of symptoms on a sheet of paper that the
Hmm.
parents fill out, the kid or the adult with the symptoms fills out,
Right.
and then a teacher fills out. Oppositional defiant disorder is a label for saying this person tends to be defiant, tends to say no, and it's a list of symptoms on a sheet of paper. So by getting the label, you're not treating the root causes.
Right.
But yes, they go hand in hand.
Okay. How can one differentiate between a strong willed child and really just a more serious or a condition that actually needs to be addressed, like pandas,
Yeah.
ODD, or anything like
Yeah.
that?
Yeah. So that's a great question. And I think that it's important. Um, you can't just look at a list of symptoms on a sheet of paper because they may look identical.
Right.
So for pandas, it's that's brain inflammation, and a child or an adult may not meet the clinical criteria specifically to make that very narrow diagnosis, but brain inflammation in general. So I always encourage parents to go to aspire.care, and there's a PANS Pandas symptom tracker that
That's
they
right.
can
Yeah.
fill out, and then they can kind of go through the diagnostic criteria and go, oh yeah, when Johnny was 4, he got strep throat and immediately he developed OCD and anxiety
Hmm.
overnight. And even though we got him treated, he has these episodes every time something bad happens,
Hmm.
or he gets strep and it gets worse and it just goes on and on. But what if he has trouble focusing and concentrating? Well, brain inflammation impairs your ability to focus and concentrate. So it's something we always think about for
Hmm.
anybody who wants to be evaluated for
Right.
ADD, ADHD. Now, if you take strong willed and ODD, oppositional defiant disorder, you also need to look, is it as something as simple as, are they developing celiac disease? Do they have non
Mm,
celiac gluten sensitivity? Are they literally causing brain inflammation every time they eat that piece of baby Gouda cheese or their Greek
right.
yogurt, drink their milk, or eat their donut, or eat their Ezekiel bread organic toast? It still has
Right.
gluten in it. It's still going to cause brain inflammation. So there's
Hmm.
too many layers there to just take, oh, you've got ADD, take this medicine, you're going to have it the
Yeah.
rest of your life, or you've got ODD. I would say no. I would say, as a parent, ask more questions. So
Absolutely.
then, for the last question, how do you tell if your teenager is, if they are just strong willed or if there's brain inflammation? Apart from doing genetics and getting a family history and checking
Hmm.
for zinc and copper and all these other things we've talked about, and that's how we partner with you.
Hmm.
Just recently, I had a family reach out for a little girl. She had just, she's turning 7.
Hmm.
Her teacher said she is the most inattentive little one in our class we've ever had. We did a big workup. She is developing celiac disease, and at age 6, Hashimoto's autoimmune thyroid disease.
Wow.
So that inattentiveness that would have been labeled in all of her life, it would have been a drug roulette. I'm so glad that they reached out. So we just
Yeah.
said, let's dig a little deeper because that's not who she is. That behavior is a sign of imbalances in here.
For those who may not have autism or anything on the sort, I know you talk a lot about there are ways to still help your preteens who may be struggling. What are some tools that you have for them?
I think it's really important to know what your preteen or your teenager's love languages are, what their temperament is, what
Hmm.
their interests are. And
So good.
if you're addressing the medical piece, the biochemical piece, and all of those other factors, I think learning how they were designed. um, I am going to include something called a website. It's called the Design, Discovery, and Development Foundation.
Hmm.
They do an assessment of personality, your child's strengths, their weaknesses,
Hmm.
what they're passionate about, what their interests are. And they may not have been able to articulate for you what those are, but I would lean into that and we'll put that connection. We don't make anything off of that. It's
Yep.
just a wonderful tool for
Hmm.
you to partner with and collaborate with your teenager. And
Hmm.
don't put on them what you think they should be doing, but
Right.
look at what that assessment shows to help them lean into what they might be passionate about, but you didn't know it, you know?
Yeah, I love that. Finding their strengths, finding their passions and partnering with that. And that almost goes to like when you're setting a rule versus just saying, because I said so, giving the purpose behind, hey, we do this because we do this why. Like, and we do that. I mean, even with our team at Hope for Healing, when we have a new policy that goes out, we have, and this is why it came out. And so I feel like just continuing learning, learning your child, learning yourself along this journey. But anyway, Dr. K, thank you so much for all of your time and the wealth of knowledge that you always bring. We look forward to more events like this in the future about different topics and maybe even more about this topic. So thank you so much, Dr. K.
You're welcome. Thanks for hosting, Lauren. You're always the hostess with the mostest.
Thank you. Bye.
Bye.